training with knee, shoulder, and hip injuries. I think you did your training at the Stedman Clinic, right, out in Colorado. So, you know, very good lineage and very great doctors. So, appreciate it. And
sure. Thank you all very much for having me, and thanks for coming. Good morning. So we're going to talk this morning about the overhead throwing athlete. It's certainly a topic that I see a lot of in clinic, and I think probably all of us as providers see a lot of adolescent athletes, especially baseball athletes, who have shoulder, elbow pain, but understanding a lot of the background behind it and how to treat these patients is kind of the goal from this morning. So I have no disclosures on this topic. So we're in a time where there's really an epidemic of overhead throwing injuries. The predominant focus, both in the professional literature as well as the lay literature, is really on ulnar collateral ligament reconstructions, or Tommy John ligaments. But certainly that's an injury, and there's other injuries that are very prevalent in this population. And we're at a time when this is really becoming an epidemic. We're seeing a lot of these athletes sustain these injuries, have a need for surgery at younger and younger ages. And we as providers really need to be involved with not only understanding that kind of background and that history, but our role is how we can hopefully prevent that and have a role in being a player in this population. I think this was a really good article. This is a cover story in Time magazine that looked at the topic of youth sports, and this was about a year ago. And they profiled a number of different athletes, but this was a baseball player who's 10 years old. And I'll let you guys kind of read this, but they kind of summed it up, and this is the reality that athletes are going through. This is a baseball player who is 10. He's traveling to Florida. He's getting asked for autographs, but can't really even sign cursive yet. And this is the thing that we have to understand as providers, that these are the forces that a lot of these athletes are feeling. These are what they're seeing in the media, and that us as providers have to really be there to educate them and try to understand how we can prevent injuries before they happen. So our goals today is to really describe and understand this epidemic of youth injury. We'll talk about some of the epidemiology and really understand the biomechanics of the throwing athlete. Importantly, try to differentiate between adolescent athletes and how those are different than adult overhead throwing athletes. We'll briefly discuss some of the common shoulder and elbow injuries. And then we'll wrap up by talking about the risk factors that a lot of these athletes have for these injuries, and then ultimately how we as their providers can hopefully help prevent them. So by way of history, a lot of us in this room are familiar with Little League Baseball. Many of us may have played. I had a lot of fun as a kid playing in Little League Baseball, but it's an organization that started in 1939, and it's certainly grown in popularity. It's played in a number of countries across the world. And from a popularity standpoint, it's the third most popular high school sport today in America. This is a picture of Williamsport, PA, which is about an hour and a half south of where I grew up in upstate New York. And this is a neat place to go if anybody has ever been or wants to go for the Little League World Series. This is kind of the culmination of Little League Baseball every year. There's a couple important differences, though, as you look at the structure of Little League Baseball. So Little League Baseball, the way they kind of define it is usually that 9 to 12 age range. And before that, they have a mound distance of around 46 feet. As they get older and into high school baseball, they're going to have a farther distance to throw, and that will bump up to 60 feet 6 inches, which is what the Major League Baseball distance is. So, a lot of these athletes in their 12, 13, 14 age ranges are not only continuing to throw, but they're also throwing a further distance, and a lot of this is where we're seeing these injuries happen. And we have had kind of a change here where previously youth athletes were playing mostly Little League Baseball, then they're transitioning to their high school teams. But now we're seeing a higher number of athletes who are involved with pitching showcases where they're going to perform for scouts, they're going to play for college coaches. There's a rise in independent and travel teams where they're playing year-round. They're really playing baseball at exclusion of other sports, and that's something that we have to understand and we have to be aware of as their providers. There's a lot of overlap with these different leagues, and a lot of times, they may not be talking between leagues and not communicating pitch counts and how much an athlete's been throwing. And there's been a lot of push among coaches and trainers to specialize to play one sport. So, that's something that we throw out a lot. There's been a lot of talk, and that definition of what is single sport specialization has, I think, really been and is still continuing to be worked out. But overall, that's about playing more than 8 months per year, and at the exclusion of another sport is what I would consider an athlete who's specialized to play in that sport. athletes who play multiple sports have time off, they give their body time to rest, and they really, that's a good strategy to help prevent injuries down the road. This kind of speaks to that. This is a 9 and under team ranking nationally that we have here. And you can see that these are teams from all over the country that are traveling to compete against each other. But we are ranking teams in America 9 and under and kind of are putting that up on the internet. And these are things that a lot of these athletes are following and kind of, searching. You can search for showcases. You can search for travel teams. You can see that you can search for 4 and under travel baseball tournaments. And if you want to play and learn how to throw when you're kind of in first grade, unfortunately, you're going to have to join a waiting list to learn how to do that. And so, these are just the realities of what we're seeing a lot in athletes and this kind of epidemic that we're seeing with a lot of athletes getting into baseball. Don't get me wrong. I love the sport of baseball. I think it's great. I love playing it. But, they should be doing and playing multiple sports. It should be something that we're doing, 4 or 5 months out of the year, but not 12 months out of the year. And as you back up and we talk about youth sports in America, there's a lot of push to play them, which is great. We want to get kids off the couch. We want to get them away from playing video games and being active. These are all good things that we can do for our athletes. But a lot of our athletes are seeing, the kind of other side of this. They're seeing youth sports being put on TV. This is a great picture that I saw when I was driving. The clarity isn't perfect, but we can enroll our kids at age 18 months into soccer. These are all options that are out there, and we have to be aware of this as we're providers going into this treatment realm and how we're counseling patients going through this. And there's a lot of money behind this. When you look at baseball, it's almost a $620 million industry, and there's a lot of participants and a lot of players, and we have to kind of understand all those different moving parts as we start to dive into this topic. It's about a $5 million industry overall, and when you think about the travel, you think about traveling to tournaments on the weekends, hotels, paying for food, time off from work. All of these things add up, and it's about a $7 billion industry, and it's a significant percentage of a parent's income who's putting this out for their child, often with the hope of college scholarships, with the hope of turning professional. But unfortunately, the reality is usually not that same hope for everyone. And so again, it's important to understand the economics. It's important to understand these showcases that are happening for many athletes. And I think it's important to realize that there's a lot of pressure on these youth athletes. I think we really should take radar guns away from youth baseball. We really shouldn't be tracking how hard it is to throw. It's important for these athletes to learn how to throw, not how hard to throw the ball. They have to learn the proper mechanics when they're younger. But these are all kind of forces that we have to work against with the current data. And when you actually look at the chance of going and playing in a college level, the numbers are they're not great for everyone. It's not that nobody can make it or I don't want to encourage that, but the reality is that if you're a high school baseball athlete, the chance of going D1 for baseball is around 2%. Overall, high school athletes, about less than 0.5% play professionally. And so the reality is that most of our patients, are not going to go on to play professionally or at a college level. It doesn't mean we shouldn't encourage them, but playing baseball at the exclusion of every other sport and at the risk of injury is something we have to hopefully counsel them so that they understand their choices and their decisions when they're young, when they're 10, 11, 12. And there's a lot of question, does specialization ultimately ensure an elite level status? And I think a lot of it is drawn from anecdotes. We see, stories of Tiger Woods, where he picked up a golf club when he was 2 years old, and stories of Lionel Messi, who was a soccer player and played, in a specialized soccer academy when he was, 8, 9, 10. And they obviously have achieved great things in their sport. And that's, outstanding, but for the vast majority of athletes, it's not the reality that they're seeing. And this theory of specialization kind of came a lot from a book, or at least it's been popularized by a book from Malcolm Gladwell, where he talked about the 10,000 hour rule. And many of you may have read this. And the idea is that if you practice or you think about a topic and you practice it over and over again and ultimately reach this threshold, that's where you kind of achieve mastery of that topic. That's certainly true in the world of music, but we have not seen that hold true in the world of athletics as much. We actually have found the opposite, that most studies that have looked at that to get to an elite level, many of those athletes actually specialized at a later age. They were the ones that played multiple sports in high school or when they were in adolescence. They weren't specializing to play one sport at the age of 10. And again, if you look at the data and really examine this, there's really two studies that have looked at this and found that early specialization leads to elite status. Those were both in rhythmic gymnastics. Every other study that has looked at this has found the opposite, that elite athletes were the ones who played multiple sports, had a broad involvement in athletics as a child, and ultimately did not specialize at a very, very young age. So we left with this confusing picture, right? On one side, we want our athletes and our youth to be involved with sports. There's a lot of benefits from playing on a team. They learn great life lessons, they're active, there's good involvement in their social image. These are all very important things and things that we would want and I would want my own kids to do. But there's also a tipping point that happens when you specialize and when we see athletes that are only involved with one sport at the detriment of some of the things that we want to achieve with that sport. We tend to see more burnout. We definitely see more injuries from overuse. And ultimately, there's a lot of pressure on these athletes to perform, and they're young. They may not have the social skills to deal with that pressure and the techniques to kind of work through that. And where these scale ends up is really, I think, where we need to, as providers, help counsel patients and help counsel their families on how to navigate this. As a group in sports medicine, we've come up with a consensus statement to try to understand this and be able to counsel patients with. And overall, we know from the literature that specializing does not necessarily lead to achieving elite status in that sport. We know that there is a higher rate of injury and burnout, and we as a group have come and kind of identified our role as not necessarily just treating all these injuries as they come in, but also trying to be involved with prevention. And that's something that I think is really one of the main take-homes from this talk this morning, is to try to be involved with that and understand the different parts of it. So what's the epidemiology of injury in youth baseball? There's a couple studies that I'll go through that kind of looked at this, and this was a prospective study that looked at almost 300 youth baseball athletes, and they found that about 30% of their athletes complained of some sort of elbow pain or shoulder pain, and that they found an association with the number of pitches thrown during a game and their athletes reporting pain. Kind of makes sense with what we know, but we have data to support that idea. This holds true across international groups as well. This is a group of 1,500 Japanese baseball players. Again, their percentage was around 15% of shoulder pain and 30% of elbow pain. And this was a prospective study. A lot of this research has been done in the Andrews Clinic down in Alabama. And they followed 480 youth baseball pitchers. And importantly, they found that athletes who threw more than 100 innings per year had a 3.5 times increased risk of sustaining an injury to their shoulder and to their elbow. So we're connecting the volume of pitches, and where this threshold is, I think we're still understanding, but we're connecting the volume of pitches with injury. And that's an important thing to match up, because that helps us then counsel the patients to say, hey, this is what you should be doing. Again, this is a study that looked at 750 youth pitchers, and they found some concerning things. We found that over half were pitching on consecutive days. 40% pitched in a league that wasn't counting the number of pitches, things that we kind of, I think, take for granted, but these are all things that, at least in 2014, were still happening. 30% pitched on multiple overlapping teams. 13% pitched for more than 8 months per year, so I would say they're specialized to play only baseball. And importantly, all of these risk factors were associated with a higher risk of injury to their shoulder and a higher risk of injury to their elbow. This is kind of their data that I won't go through right now. And then when you look at arm pain, again, this found that most patients had arm pain after throwing. This was kind of more the reality than it was the exception. So only 26% reported no pain during the day or the day after throwing. And there's consequences of this. There's, athletes want to enjoy their sport. They want to have fun at what they're doing, and if they're hurting, that's going to have some consequences down the road. And I think that looking into this, and the main reality is that youth athletes are not adult pitchers. They're developing, they're going, most of them are going through puberty during this time. their skeleton is growing, but their muscles or ligaments or tendons are usually catching up to that. So they can have an imbalance, and that can put them at risk for injury. And there's a couple quotes, and this is Dr. Andrews in 1998 that really is saying that the best time to prevent injury is to teach the proper pitching mechanics early on. And it's important to realize that throwing a baseball, is a high-level thing. It requires a lot of coordination. It puts a lot of force through your elbow, through your shoulder, and it requires time. It requires teaching those mechanics. And that's something that I think we should really be focusing on at the youth level, not necessarily just teaching them how to throw harder or other things like that. And that's what I think we need to focus on. This is a slide that just looks at the overall phases of throwing that leads from wind up through late cocking, through to early acceleration, and ultimately follow through. And there's different structures that we typically see that can be injured during this time. So typically during the late cocking, early follow through is where we have a lot of force through our elbow. Usually we'll see injuries to the ulnar collateral ligament around that time. During the follow through phase, we see a lot of posterior shoulder type symptoms, rotator cuff, posterior labral pathology. Different times during the course of the throwing motion can help us identify areas that could be injured. And again, some general principles is that these are youth athletes. They're still developing, they're still growing into their body, and their muscle coordination and control is not necessarily optimized at this point. Many of them have poor posture, don't have great scapular mechanics, and ultimately we need to educate them on the importance of stretching, on the importance of sleeper stretches to help improve their shoulder range of motion, the importance of understanding what a kinetic chain is. And what that is that the throwing motion really begins from the ground up. So as a youth athlete, you can't just focus on your arm, you can't just focus on your shoulder, your elbow, you should be focusing on lower extremity strength as well, focusing on core strength, because if you're off balance, if you have weak hips, all of those are things that can downstream put more force through your shoulder and put more force through your elbow and ultimately lead you to injury. So this is kind of this progression that we've typically seen in youth athletes, where if they have poor mechanics, they put poor, improper stress through a growing body, and then ultimately they can have a higher risk of injury. And we have to intervene, and we can educate, families, we can educate parents on how to ultimately, hopefully, prevent injuries and not, be in our office needing treatment. So from a biomechanics standpoint, there's a couple studies that have looked at this. This was a study that looked at almost 300 pitchers and kind of analyzed their biomechanics, and they found what we would think is that older pitchers really had better biomechanics. But that means that we need to identify those youth pitchers who are at risk and really teach them the basics of how to throw a baseball. There's some specific things I identified. Younger pitchers tended to have their hand underneath the ball rather than on top. And over time, that's something where, as their grip strength improved, their coordination improved, they were able to pitch with the ball with their hand on top. They also had a longer stride length. So you can see the more adult pitcher on the left versus a youth pitcher on the right. Their stride length improved as they developed, as their strength improved, their balance and coordination improved. And so these are all specific things that we can look for when you're looking at a throwing athlete. We also looked at their knee flexion angles. They had higher knee flexion angles as they were more adult pitchers, and youth pitchers had a lower knee flexion angles. And then also looking at their trunk balance. And these are all things that you can measure in a motion lab, but ultimately do change over time. But we have to involve coaches, we have to involve parents to teach these biomechanics as they're growing. This is a similar study that was out of Curlin Jobe in LA that also looked at biomechanics, and they found that for youth pitchers who correctly did the biomechanics, meaning where their hips were leading towards home plate, the arm position with holding the ball, as well as their kind of shoulder angles as they're coming to home plate, if you correctly did that, they found that they had lower torque through their elbow, that they had lower load through their elbow, and ultimately had better pitching efficiency. So you can correct these things, and that the pitchers who do them well, they ultimately have lower risk of injury and lower amount of forces going through their shoulder and through their elbow. This was another study that looked at the changes in kinematics and really brought the idea of fatigue up. So we can teach athletes how to do this in a biomechanically sound way, but do they maintain that over the course of throwing? Does this change as they fatigue, as they go throughout the course of a game? And what they found was that, yeah, it does. They found that over time, the ball velocity decreased, and that their lower extremity kind of transition and preparation towards home plate was not as ideal as the pitcher's fatigue more. So all of that can carry on downstream to overuse injuries and putting their shoulder and their elbow at higher risk for injury if their lower extremities are not as optimized moving forward. And then again, this was I think an important study that longitudinally followed the same athlete over 7 years, and they tracked their biomechanics. And they found what we would assume is that over time their biomechanics improved. That cutoff was around usually 13 years old when a lot of the pitching variables were improved to a point where they would say it's more of an adult type level. But it's really neat to be able to see the same athlete over time. So you can see the hand position from the younger athlete on the left to the older athlete on the right. So again, same person, years apart. So their biomechanics do improve, but we need to identify that youth athlete who wants to be a pitcher and work on these biomechanics at a young age. This doesn't happen without that teaching component with their coaches. Again, their shoulder angle, how open or closed their shoulders are as they deliver to home plate does improve. Look at the lower extremity differences, kind of the where their toes are pointing, knee strength. All of these are different, their stride length. All of them are different things that we can look at and try to improve their biomechanics. And again, youth athletes are not adult athletes. They are growing. Their physes are very active. And that anatomy is important for us to remember. Often the growth plate is the weakest point along the chain and may be injured with overuse injuries. And there's a couple of them that are pretty common. I would say most common would be a little leaguer shoulder, but we also see injuries to the labrum, to the rotator cuff, different growth plates in the shoulder, both the acromion and the distal clavicle. But just because there may be a finding on an X-ray or an MRI, it doesn't mean that this might be abnormal might be not normal for a throwing athlete. So just because you have a finding on MRI doesn't mean that person needs surgery right away. Oftentimes that finding may be normal for the throwing athlete, and if you correct kinetic chain, if you correct their mechanics, then their pain will go away without any sort of surgery. I want to transition a little bit to talk about a couple of these injuries. Little leaguer shoulder is certainly one that we see pretty common. It's often male athletes. It's often mostly pitchers, and there tend to be something that presents and kind of, at least initially, difficult to diagnose. So the time to presentation or time to diagnosis tends to be kind of long, which is around 7 months. It's called a number of different things, but really what you do when you examine this patient is they tend to be very lateral shoulder, but have full range of motion and usually good strength of their shoulder. And when you look at their x-rays on the left, you can kind of see the classic finding, which is widening of that growth plate on the lateral side or the outside part of that shoulder. And on the MRI, you'll see that it lights up. There's edema at that growth plate. And that patient needs to be shut down. And that doesn't mean that they just have to do nothing and sit and play video games, but they need to be involved with active rest. So they should refrain from throwing. My minimum is usually around 6 weeks, and then in that time period of where they can connect and kind of correct the kinetic chain abnormalities that may be causing this. So working on their strengthening in their legs, working on their core, ultimately can hopefully improve their ability to throw and improve their ability to throw without pain and without injuries like this. When they return to throw, they should be going back with an interval throwing program. So it's not just a, hey, you're okay, you can go back to throw and then get right back into a game situation. They should work up to that. And they should throw, initially short toss and then work on mound throwing and then ultimately game type situations as a way to work them back up to that type of a competition. From an elbow standpoint, again, these are all pretty common in overhead throwing athletes. The elbow growth plate tends to form around the ages of 5 to 7, but takes a little while to actually fuse and doesn't fuse until a little later, around the ages of 15 to 17. And you kind of see a range of injuries that can happen for a throwing athlete in their elbow. Certainly the most common and the one that we hear a lot about is the ulnar collateral ligament. And there's a spectrum that happens depending on the age of the patient and where that growth plate is in the process of fusing. Usually younger patients can have a similar injury to the little league shoulder, and this is kind of an apophysitis of that medial epicondyle. So you can kind of see to the right side of the screen, there's widening of that growth plate. And again, this is treated without surgery. This is treated with rest and return to throwing program after an appropriate time of rest. As they get a little older, you can have actually an avulsion fracture of that growth plate. And, for a throwing athlete, what's important to remember is what's attached to that growth plate, and that's your ulnar collateral ligament. So if it's significantly displaced, that may be something that would need to be repaired and need to have surgery for someone who wants to continue to throw. The current thinking is probably around 3 to 5 millimeters of displacement, but that may depend on who you ask for and how much they're willing to accept. And then again, as you get a little older, you'll kind of get more into the adult type spectrum of ulnar collateral ligament injury. What that is that's the ligament on the medial side of your elbow, that prevents valgus stress, and it's certainly things that pitchers, have a lot of risk of injury. There's a whole spectrum of kind of the changes that can happen with throwing, and ultimately the treatment tends to be, depending on the injury. So some may just need rest from throwing, working on kinetic chain. Other may need injections, consideration of PRP. Some may repair the ligament. Others may reconstruct it. There's kind of a whole, spectrum of what could be done, but that's a little bit beyond the topic of this discussion here today. But certainly in this adolescent population, the idea of reconstructing it, I think, is a little less common. But as you get older and that growth plate is fused, then that's something where, that becomes more common. Over time, we do see changes in the ligament. So repetitive throwing, on ultrasound, we can identify changes. We see that ligament thickens. We don't know whether that's an adaptive response. So, it makes sense that if you're continuing to throw a baseball, that UCL may thicken as a response to that stress, or whether that's a pathologic thing, whether that's something that predisposes you to an injury down the road. And we're still trying to really understand that, but we're beginning to track these changes with different research that we're doing. And in this age population, there's certainly good data for repair. This was out of Tulane that looked at UCL repair, and they had really good results. They found that 58 out of 60 patients were able to return to play with ulnar collateral ligament repair versus a reconstruction. But again, a lot of that depends on where the injury is and whether it involves kind of the mid-substance, proximal UCL, distal. There's a lot of variables to kind of consider with that. But certainly nobody's arguing that the number of UCL reconstructions is rising, and pretty dramatically. If you look at this chart compared to when we started this with Tommy John's reconstruction to now, you can see certainly the rise of UCL reconstructions. And I can hit that point home with a couple other studies that have looked at that, and the rise of reconstructions is happening mostly in this population of around 15 to 19-year-olds. So it's happening as these adolescent athletes are getting into high school, and ultimately probably the seeds of that need for a reconstruction were sown when they were younger, when they were pitching a lot and weren't having great guidance, and ultimately putting their UCLs at risk for injury and needing a reconstruction. This was a study that looked at a New York State database and looked at 10 years of data, and again it found that UCL's surgery had almost a 200% increase over that time. And so this is something that is being performed more and more commonly, and that the real big riser of that was that 17 to 18 age group. So that 17 to 18-year-olds were the ones that were seeing needing this surgery, unfortunately, more and more frequently. So what risk factors can we identify? This was a study I looked at earlier. Again, athletes who threw over 100 innings per year had a 3.5 times risk higher of injury. When you looked at other studies from Andrew's clinic, they found that really pitchers who pitched more than 8 months per year had a 5 times higher risk of shoulder and elbow injury. They found that if you threw more than 80 pitches per outing, you had a 3.8 times higher risk of injury. And I think really the big takeaway here is that if you pitched with arm pain or arm fatigue, you were 36 times more likely to injure your arm and injure your elbow. So, when the athlete presents to you and they have pain or they feel fatigued, it's not a, hey, Johnny, play through this. It's we should stop and we should look at why you're having pain and why you're having fatigue, and give you some time to rest. The question of, is it curveballs or splitters that are causing this is something that's certainly very common, and I don't think we really have the answer for that yet, unfortunately. Initially, there was a study in 2002 that did show that there was a higher amount of force going through the elbow with off-speed pitches, but then there's been a couple subsequent studies that have kind of debunked that. And so ultimately, I can't answer that question for you. This is probably something you guys get asked a lot, and certainly we get asked a lot, is when should this athlete begin throwing off-speed pitches? We don't have really great data for that, but again, it really speaks to the pitching as a whole, to understanding that it's not just the ability to throw an off-speed pitch, but we should be teaching proper mechanics, teaching how to stretch, how to rehab, how to warm up. All of those things are ways to prevent injury rather than kind of teaching the nuances of a certain grip and different holds. And this is, I think, one of the scary things that we have to realize is that when you ask patients and you ask athletes about ulnar collateral ligament reconstruction, whether they think and what they think about it, many of them think this should be done prophylactically, that we should take patients and we should perform this surgery ahead of time to get them ready for the next stage and prevent an injury down the road. And certainly that's not anything that I want to be involved with, and you probably as well. But these are what a lot of people are believing, and this was a study that kind of looked at that. So this is what we have to be aware of, and this is kind of the forces that we're working with, in society right now. Again, there's another thought too, that there's a risk factor for playing both pitcher and catcher, and this is something that's coming out, I think, more recently. This is a study that looked at almost 384 high school pitchers, and it compared those who were pitchers to those who were both pitchers, and then on their days off were also playing catcher. Catcher throws the ball a lot too, and so it's not really a whole lot of rest from throwing if you're throwing it back every pitch to the pitcher. And this study identified that it was almost a 3 times higher risk of shoulder and elbow injury if you did both. So really, maybe we should be recommending that during our time off, these pitchers should be a different position, or certainly be tracking this and being more aware of it. So to summarize, I think from a risk factor standpoint, playing baseball 8 months a year is certainly a risk factor for shoulder and elbow injury, burnout, things like that. Playing fatigued is also a risk factor. Playing multiple leagues, multiple showcases that aren't kind of coordinating and tracking that all together is certainly something we have to be aware of. But there's common sense recommendations for that. Take some time off from throwing. Play other sports, cross-train. There's other activities that can, help an athlete's development, help their coordination, and ultimately help them play better baseball. But that doesn't mean that they have to play baseball 12 months out of the year. We should be setting limits on their throwing. We should be really tracking the amount of leagues that they're playing in, and ultimately following the recommendations of the PitchSmart guidelines that I'll talk about in a second. These were really a combination from us as orthopedic surgeons who are seeing the kind of downstream effects of overuse injury and working with Little League Baseball to set these up. They're very available on the internet. These are things that all Little League coaches really have access to and should be following. But it means that if your 12-year-old pitcher threw 51 pitches, they should have 3 days off of rest. That's hard when you go and you travel and you spend the money and you go down to Florida with a team and they have a game Friday and that person is your best pitcher and you want them to pitch Sunday. That's the hard forces you have to work against, and that's the reality that we're seeing a lot of happening with these athletes. But it's important to realize that we don't know exactly what the right amount is yet. This is a study that looked at pre and post Little League season MRIs. And they found that even with pitchers who followed the guidelines, that there were changes to their anatomy on their MRIs. Now, those don't mean that those changes were symptomatic, and they certainly don't mean that they needed any intervention, but we don't know exactly the final word on this yet. When you look specifically, though, not every one of these athletes kind of followed all of the recommendations, so maybe their PitchSmart counts were okay, but they were still playing multiple leagues, or they were still only playing baseball throughout the year. So there's a lot of variables that we have to take in as you're seeing a patient and taking a history of what's going on. There's, I think, a really nice throwing score that Chris Ahmad put together, who's the Yankees doctor up in New York City. And this is available online. And he has a survey that every pitcher that comes in who's a youth pitcher can fill out in the office. And he can get a score about kind of the risk of injury, kind of how often they'll throw with fatigue, all these other factors that can then help guide that conversation and be kind of a way and a tool to inform the parents, inform the athlete of their risk, and kind of ways that we can decrease that risk for them. There's apps on your iPhone that can track your pitch counts. They can give you a warning to say, hey, Johnny had thrown the amount of pitches. It's kind of the max for today. You, as both a parent or a coach, should intervene, and we should get him out. We shouldn't keep pitching him throughout the day. And to close, I think there's a couple quotes here that some big name baseball pitchers have put out there, and certainly Tommy John is the famous baseball players who played for the Dodgers. He tore his ulnar collateral ligament, And he was the first athlete who had this reconstructed by Frank Jobe in LA. And he was able to get back to pitching, but his quote is really poignant, and I think it really still lasts today. And he said, I think what these kids do in youth baseball can lead to Tommy John surgery. If you have your kids' best interest at heart, let them play another sport. Play baseball up until September, but then go play football, go play basketball, go play soccer, lacrosse, do something else and let your arm rest, and then get back to it in the spring. And I think that's an important take-home that we should remember as we're talking to these athletes. John Smoltz is a famous Atlanta Braves baseball pitcher, and he was the first professional athlete to be inducted into the Hall of Fame who has had Tommy John surgery. And he says, I don't think I ever grunted when I was throwing a pitch. I stayed in a comfortable area. I never saw a radar gun until I was in high school. But now what we're seeing with kids, they're throwing with max effort. They're getting hurt, unfortunately, at younger and younger ages. And these, athletes who are having Tommy John surgery when they're young are ultimately probably not the ones, this isn't scientific, but this is his opinion, who are getting back to the big leagues. So I think this is the recommendation that we have to kind of take. And, when you combine these statistics and you put them on one page, they're kind of scary. We look at the number of leagues who don't have pitch counts, about 45%. A lot of athletes are throwing on consecutive days. They're playing on multiple teams. They're playing multiple games on the same day, and they're pitching multiple games on the same day. And their risks are there. You're playing 8 months a year, you have a 5 times higher risk. I think this fatigue one is really important. It's a 36 times risk of injuring your shoulder or your elbow. And so these are things that I think are good statistics that we can use to educate the family, educate the parents that say, I want your athlete to be out there year-round. I don't want them to be sidelined by an injury, by needing time off to heal. So if we take a prophylactic approach and we take a preventative approach, then we can do this the right way and ultimately have you hopefully happier in your sport and playing your sport, not needing time off to heal from an injury. So I think from a takeaway standpoint, I don't want you to get me wrong. I love the sport of baseball. I played it. I'm a huge Mets fan. And I want athletes to be involved with this, but I want us as providers to help keep those athletes involved and help to do it in a safe way. So, I think that athletes really should not be playing one sport year-round. I think they need to be involved with multiple sports. They should have at least 3 months off a year from throwing, and it should be continuous, and it should really be a time for that arm to rest and to recover from whatever was going on those earlier 9 months and allow that body time to heal. I think these athletes should be playing multiple positions. I think we should get radar guns out of youth baseball and really make that something that happens later on. And youth baseball should be a time where we teach them the mechanics, we teach them the fun of the game, not necessarily how to throw the fastest. And that sometimes gets lost, I think, in the day-to-day realities of what we see today. Certainly these recommendations are great and something we'll continue to improve on, and we should be following those. But the bottom line is that we need to educate the athletes, we need to educate the coaches, we need to educate the parents that we've got all this data, but it needs to get to them. So I think there's still a lot of belief that, playing baseball and specializing to travel and to do this year-round and do it at the age of 10 is the best way to become a college baseball pitcher and to pitch professionally. But, we have at least the beginnings of a pretty significant argument to go against that. And then again, we should be teaching the mechanics, and this should be age-specific. So with that, I'll end, and I appreciate all your guys' attentions. I'm happy to take any questions. Sure.
When you prescribe rest, is it just for the pitching, or is it allow to play other field positions?
So it's a good question. I think that the idea of rest should be that active rest. I'm okay with playing other positions as long as it doesn't hurt them. So if they can throw, if they can play an infield or an outfield and they can throw, a lot of times pitchers will have pain, but it will only be after 20 pitches when they're on the mound and they're throwing repetitively. I'm okay with them playing another position, but they should be doing things on the side. They should be working on correcting lower extremity, core, all of those things I think will make that rest period really as productive as possible. So if it doesn't hurt them, I'm okay with them playing another position during that rest period. Sure.
What is the youngest age you've seen with the UCL tear or having to do
So reconstruction, again, a lot of that age group, most times reconstruction isn't happening. I mean, I've seen people in the literature, I've seen, 10, 11-year-olds having a UCL repair. I haven't seen a reconstruction that young, but certainly that avulsion fracture off the growth plate is something that happens in that 10, 11, 12-year-old age range, depending on the maturation and where that specific individual is. But that's the same idea. It just is, instead of the ligament failing, the growth plate is kind of the weakest part of the chain, and so that tends to fail for that picture.
Are these injuries just specific to baseball, or do you see the same with maybe volleyball, tennis, any kind of overhead?
It's a great question. Typically, you can see a lot of the same spectrum. To the repetition, it tends to be a little different, and the mechanics are a little different. Hitting a volleyball, you can see this with javelin throwers. Softball is similar, but does have different mechanics. So a lot is specific, but I think the general principles apply to really any overhead athlete. Great. Thank you very much for your attention, guys.